I'm Dr. Ken Landau. This is Well Now Doctor. Thank you for joining us. We're going to be discussing hepatitis C. Hepatitis C is a very important condition. It's a virus. It attacks the liver, hence hepatitis. It fortunately does not typically cause symptoms. That's right, you can be infected with a virus that can stay in your body for 20, 30, 40 years and cause absolutely no symptoms. On the other hand, for reasons that we're only beginning to understand, in some people, the virus attacks the liver, causes a subclinical hepatitis, may lead to, over a period of time, some malaise, some fatigue, some other issues, can cause cirrhosis of the liver, and then cirrhosis of the liver is thought in a very small percentage of the people to go on and lead to a primary liver cancer. Now, we're not talking about the kind of cancer that starts in the colon or starts in the breast and then spreads to the liver. We're talking about a cancer of the liver cells. We call it hepatocellular carcinoma. Now, what do we know about this virus? It's in the news a lot, and part of the reason it's in the news is not because of medical issues, it's financial issues that bring it in the news. Financial issues because treatment of the virus is so expensive. It's the darling of the pharmaceutical industry. There have been a significant number of drugs recently approved to treat hepatitis C. The drugs work, and they work very well, cause relatively few symptoms, but they're horribly expensive. It costs well in excess of $100,000 to treat each person, and unfortunately, we know that there are a significant number of people infected with the virus. But the question is, if you're infected with a condition that isn't going to go on and cause any kind of symptoms, isn't going to shorten your life, and for the overwhelming majority of people isn't even going to cause a symptom, then should it be treated? Should it be sought after? Well, that's an issue that we have to address because, unfortunately, we have significant number of people and horrible expenses associated with the condition. But we have a real condition, a condition that in many cases will warrant some sort of intervention. Now, it's the most common pathogen, bloodborne pathogen in the United States at the present time. And as an example of its ferocity as it attacks the liver, we know that prior to the early 1990s, fewer than 1 in 10 people who presented for liver transplant were infected with this virus. Now, we know, depending on the particular center, in excess of 30% of all people, maybe in excess of 50% at some centers, present because their liver is being attacked with this hepatitis C virus, a virus that for many people, once you're infected, you'll stay infected for the rest of your life. It is possible to clear the virus spontaneously, but that occurs in the minority of people. Now, even though hepatitis C and hepatitis B are talked about, we think that the AIDS virus is a lot more important. But I just remind you that overall, hepatitis B and hepatitis C are at least 3 or 4 or 5 times more frequent than the AIDS virus. Also, the hepatitis C virus is relatively newly identified. It was only identified in 1989. Prior to that time, yes, indeed, there were a lot of people who had hepatitis. We talked about hepatitis A, the infectious hepatitis that you would acquire because you consumed some food that was infected. Maybe you drank some water that was infected with hepatitis C virus. There was the hepatitis B virus, the serum hepatitis, originally thought mostly parenteral through blood transfusions or through intravenous drug abuse, later thought to be acquired sexually in a significant number of people. But those viruses could be identified. A lot of people had what seemed to be hepatitis, but we couldn't identify a virus. We called those people non-A, non-B hepatitis patients. Well, in 1989, we found that there was indeed a cause of their particular condition, and it's this hepatitis C virus that can go on in a small percentage of people, probably somewhere less than 15% of all of those infected, to cause problems But at least 85% of the people infected, well, they're not going to have any symptoms, no problems associated with the virus. Now, it's important to realize that this virus is widespread throughout the world, and most experts anticipate that the true number of infected people in the world is somewhere between 150 million and 170 million people. Now that means that somewhere around 1.5%, maybe 2%, or even a little bit more are infected with the virus. Now that's obviously a significant number, and it seems like in certain areas of the world the virus is increasing in frequency, especially with intravenous drug abuse. That seems to be one of the principal mechanisms of transfer of the virus. Now, in spite of the fact that most experts agree the number is probably somewhere around 150 million, 170 million, some new information suggests that the virus might not be really that widespread. Only maybe 80 million people throughout the world might be infected, but that's still a significant number. And we have to differentiate two groups of people. One group of people who have the antibodies to the virus, and the other group of people who actually have the virus growing inside their bodies. Now you see, because you can clear the virus in probably a quarter of the cases, so maybe about 20-25%, 1 in 4 people who are infected are able to get over the virus, clear the virus from their system. Well, the antibodies are going to stay forever. So just because you have an antibody to the virus doesn't mean you're currently infected, but probably 75% of the people are. So at least in the case where the new number comes in at 80 million, it's estimated that, well, maybe 75 million people actually have the live virus inside their system. A significant number, whether we pick the 60 million, 80 million, 150 million, lots of people are infected with hepatitis C. We know that in different areas of the world, the likelihood is considerably different. So, for instance, if we look in Asia or in North Africa or in the Middle East, the number of people infected is in excess of 3.5% of the population. Significant number of people to be infected. If we look at North America, if we look at Europe, Eastern or Western Europe, the numbers are more reasonable, somewhere between maybe about 1.5% and 2.5% of the population. If we look throughout the world, there are certain hot spots for this virus. So, for instance, we know that half of all of the people infected in the world live in 6 countries. We know that if we look in China, there are 9 million people infected. If we look at Pakistan, the number is about 7.5 million. If we look in Nigeria, the number is 7.5 million. If we look in Egypt, the number is about 6 million people. If we look in India, it's also 6 million people, even though the population is considerably greater. If we look in Russia, there are about 4 million people. If we look in the United States, which is number 7 on the list, there are somewhere around 3 million people infected with this particular virus, which means about 1.5% of the population. Now, it's important to realize that we have certain subpopulations here in the United States. So if we look at those people who are incarcerated in jails and prisons throughout the country, we find those individuals have a much higher incidence, an incidence that can go anywhere between 20% and 40% overall of the prison population. If we look at the number of people who test positive for the antibodies, doesn't mean that they're currently infected, but means that they at least were exposed to the virus at some point in their lives. It's 3 to 5 million. Significant number. If we look at the number of people who actually have the virus growing in their bodies, well, it's probably about 2.5 million here in the United States. Now, with appropriate therapy, we can make this a rare disease. We can make it a non-existent disease in the course of the next 20 years. Question is, what is the likelihood of dying if you're infected with this virus? Well, the likelihood is relatively small. It's estimated that somewhere maybe 15,000 people each year are going to die out of the total number, the 3 million or so who are infected with the virus. We also know that some experts say that that's a gross overestimation, that the true number is only going to be 3,000 or 4,000 or 5,000. Nobody believes it's going to be more than about 17,000. We know that in spite of the fact that we talk so much about AIDS and how AIDS is such a terrible disease and leads to such a high incidence of death since therapy, well, we now know that hepatitis C, actually since 2007, has caused more deaths than the AIDS virus. The economic burden of treating this disease is substantial. The amount of time lost from work, the amount of medical attention consumed simply by treating the disease, treating those people infected with the disease, it costs us about $6.5 billion a year. That's prior to the time that we began all of the fancy treatments that are supposed to save us money but seem to be costing a significant amount of money. Now, what do we know about the likelihood that the hepatitis C virus is going to go on and lead to some kind of complications? For instance, cirrhosis of the liver. Now, just because you have cirrhosis doesn't mean you're going to know that you have cirrhosis. It also can be asymptomatic. However, it may progress over time to liver decompensation. It can cause a hepatic encephalopathy. It can cause bleeding. It can cause horrible manifestations. Well, that's cirrhosis. In probably 1 out of every 4 cases is caused by chronic hepatitis C, the hepatitis C that has been growing inside for 10 or more years, often 20 or 30 years. And if we look at that liver cancer that I mentioned a moment ago, the primary hepatoma, or the hepatocellular carcinoma, it's thought that probably 1 in 4 cases, again, is caused by hepatitis C. How common is liver cancer in the United States? Not the kind that goes from the liver, goes from the colon to the liver or the breast to the liver, but the kind that develops in the liver itself. Well, it's thought that probably about 15,000 men and about 6,000 women are going to develop this particular kind of liver cancer, a cancer that is the result of cirrhosis from hepatitis C or hepatitis B, or a variety of other causes, even from simply being overweight or drinking alcohol, very common causes of cirrhosis, and then go on to progress to liver cancer. And if we talk about chronic viral hepatitis, well, the incidence of chronic viral hepatitis caused by hepatitis C is thought to be about 50%. Now, in certain areas of the world, there is an extraordinarily high likelihood of infection with this virus, and there's probably no greater area of infection than in Egypt. Egypt? Yeah, Egypt. And that's because in the 1950s through the 1980s, the Ministry of Health, of all places, the Ministry of Health, decided that they were going to begin a campaign to eradicate a parasite that caused a disease called schistosomiasis. And unfortunately, they gave parenteral injections into the body with unclean needles. They used reusable glass syringes and they didn't sterilize them. And as a result of the lack of sterility, a significant percentage of the population, estimated probably about 80% of the population, who were treated with the anti-schistosomiasis preparation became infected with the hepatitis C virus. Now, if you look at the current population, well, they're not given the injection therapy, they're given oral therapy, and a relatively small percentage of the population, the background level of population, has the virus. So if we look at the risk in Egypt, we find that the number 1 cause of hepatitis C in Egypt right now is previous therapy for the schistosomiasis, or preventive therapy for the schistosomiasis. But since so many people have the infection, now when other people are given blood transfusions, well, a lot of the donors are infected. They don't have as good a testing as we do here in the United States, and as a result, a significant percentage of the population going to go on and become infected because of transfusion, or during surgery, or during dental therapy. We know that the incidence of hepatitis C virus in Egypt is the highest in the world overall. It's estimated still today that it's somewhere around 15% of the people who were treated for schistosomiasis The population, well, it's probably somewhere in excess of 35%, especially if people are over age 40. If we look at pregnant women, the likelihood of infection, about 10, 15%. If we look at blood donors, it's maybe 5, 10, 15, 20, 25%. If we look at the people on dialysis, well, a significant percentage, maybe as many as 50, 60, or 70% are infected with hepatitis C. If we look at the general population in Egypt right now, as I said before, somewhere, depending on the age group and the location, whether we're talking about urban or rural population, young or old, we're talking about 0 to 40% of the population infected. And if we look at the high-risk individuals, it's somewhere between maybe around 10 or 20 or 30, up to 80% of the people. If we look at where the people live, people who live in rural areas are more likely to be infected than those in urban areas. Men are more likely to be infected than women. And if we look at children born to women who carry the virus, the child's risk of developing the virus is somewhere around 25%. Healthcare workers over in Egypt right now, up to 20%. Barbers, up to about 12%. Significant percent of the population because of this unfortunate attempt to treat a different disease. Well, obviously, with passage through international borders, the hepatitis C that might have started in Egypt can go to a variety of different countries. Now, let's discuss where in the United States it's likely that the virus comes from. Well, we know right now there's a major focus of attention on people, the baby boomers, the people born between the years 1945 and 1965. It's estimated that that population group is probably about 5 times more likely to be infected than any other age group. However, over a period of time, we're now finding that a lot of relatively young people, because of intravenous drug abuse, are also becoming infected. So the younger population. So now we have 2 humps, 2 peaks in the level of infection of hepatitis C. It's estimated that, at least in the people born between the years 1945 and 1965, maybe as many as 3.5% of the population is infected, as opposed to, say, about 1.5% of the general population. It's estimated that in the United States, maybe as many as 3 out of every 4 people infected with the hepatitis C virus is infected in that particular age group. Well, question is then screening. Should we screen people? Well, the United States Preventive Services Task Force, organization that's charged by Congress, not a governmental organization, but a private organization of doctors, was charged with deciding whether to screen people. And in 2004, they reviewed all of the evidence and said that, well, they didn't really recommend that people should be screened. They changed their mind in 2013 and said, well, there's okay evidence to suggest, not really strong evidence, but okay evidence, moderate evidence to suggest that it would be a good reason to screen people born between the years 1945 and 1965, screen them for this particular virus, and then consider some sort of therapy. Well, what's another group? Groups that are associated with the transfer of blood. So, for instance, we know that the virus happens to be especially prominent in those people who are intravenous drug users. And we know that if we look at the population of those in jail, the number of people who are infected is enormous. It's estimated that overall, if we just look at the prison population, that probably somewhere around 25% or more of the people in prison are infected with hepatitis C. If we look at intravenous drug abusers in prison, well, the percentage of those people that are infected may go up as high as 90%. 50 to 90% thought to be probably pretty accurate. And if we look at people who are new users of intravenous drug use, people who abuse drugs, just started, well, within 6 months, it's estimated more than half of them will become infected because they use contaminated needles, contaminated paraphernalia. So that's obviously a significant issue. Well, you can get some blood by other means. So, for instance, transfusion, or those people who were receiving clotting factors or other kind of blood products prior to discovery of a test, prior to about 1987. Well, those people had a very high likelihood of being infected. As a matter of fact, hemophiliacs were probably all infected in the early days up until the late 1990s, when we became very cognizant of this. People who received organ transplants, well, the likelihood of becoming infected was rather high prior to the early 1990s. Now, all of these are relatively rare. The likelihood of receiving blood that's contaminated with hepatitis C, it's thought to be very, very small, maybe as few as 1 unit in every 2 million that are transfused. So not likely that you're going to become infected that way. The risk of transfusion is very low for all of the chronic viruses, the hepatitis B, the hepatitis C, and the HIV. And we use pooled samples, lots of different ways to evaluate the blood. But there is the possibility, because it takes a certain period of time from infection until the blood tests are able to show that the virus is there. It takes a couple weeks. So there's a small window. Now, in people who were suffering from kidney failure, who were hemodialyzed, again, the likelihood of infection at one point in time prior to the 1990s or so was about 100%. On the other hand, now it's considerably smaller. Very unusual. Now, another problem is what happens if you have a tattoo. The likelihood of receiving an infected needle while you're getting a tattoo, if you go to a reputable tattoo parlor, is relatively small. On the other hand, if you get a tattoo in prison, as so many of the incarcerated population will get, well, unfortunately, the likelihood of becoming infected through those kind of tattoos is very high. What about sexual transmission? Is sexual transmission a method for transferring hepatitis C? Well, it's thought in those monogamous relationships, those long-term monogamous relationships, even if one partner is infected, the likelihood of the other partner becoming infected is very small, anywhere between 0% and 0.5% per year. The average is only about 0.1% per year. So it's very unusual for this virus to be transferred in those people with long-term monogamous relationships, husband and wife. On the other hand, people who have lots of sexual partners, it's a lot more likely to spread the virus. It's so unlikely in monogamous relationships that condoms are not necessary. They're not even suggested. On the other hand, in those people who are more sexually liberated, you got to be careful. You have to be careful. The risk of sexual transmission, well, in those people who are having multiple relationships, multiple people, it could be anywhere up to about 10%. And that's especially if any of the partners carry the HIV virus. It seems the HIV virus alters the body's immunity and allows the ready passage of the virus. And unfortunately, not only does it assume the passage of that virus, but the HIV virus as well. Well, why isn't it so frequently transmitted sexually is a question that always has confused researchers. And the question is, maybe there's a lack of target tissue in the genital tract, or maybe there are just low levels of the virus in the genital tract. But for whatever reason, it seems that in those normal relationships between husband and wife, the likelihood of transfer of the virus is relatively small. Now, that brings up another issue. What about men having sex with men? different story, and it's a different story especially if one of those individuals carries the HIV virus that allows more of the hepatitis C virus to grow in the body. Well, we know in those men who have sex with men, the likelihood of passage of the virus, the hepatitis C virus, is very high, perhaps as many as 25 or as great as 25%. And as a matter of fact, if those people are treated, if they're treated and they're successfully treated for the hepatitis C, a significant percentage of those people will become reinfected over the period of the next 2 years, because we know that unfortunately you get no long-term immunity from this particular disease. And if you happen to be co-infected with both the HIV virus and the hepatitis C virus, you're going to have a lot more problem. The disease is going to become more aggressive. It's going to go on, and the combination is going to lead to kidney disease and neurocognitive dysfunction, goofy in the head. You're going to have bone disease. You're going to have cardiovascular disease. You have to be very careful. Now, we know that those two viruses seem to share the same, the hepatitis C and the AIDS virus, share the same modes of transmission. And it seems that after about the year 2000, we've had a significant increase in the number of men having sex with men who are infected with this, perhaps due to sexual practices. There's fisting and there's group sex and there are other mechanisms where there's exposure to blood. So we know we have to be extraordinarily careful when we're talking about the HIV associated with hepatitis C, because it increases the burden. We have a faster progression to cirrhosis. We have less response to our current therapies. And then the question is, if we treat the person who has the co-infection with the standard medicines for AIDS, well, that might be even harder to take on the liver. So we have an issue with treatment for the AIDS virus. Something to consider. Now, colonoscopy, that was certainly in Las Vegas an issue some time ago where there might have been transmission of the virus. And we know that in a very, very small percentage of the people, it may be transmitted that way. We know that it's a good idea, if you are infected with the hepatitis C virus, that you don't share any instrument that might be contaminated with blood. So don't share a toothbrush, don't share a razor, don't share a nail clipper, any of those things. What about the likelihood of transmitting the virus or catching the virus if you're accidentally stuck with a needle? Well, the thought is it's somewhere around 2% per exposure, might be as high as 10%. If you are in the healthcare field and you are accidentally stuck with a needle that is from some other person, well, it's a good idea to test that other person to see if they have the virus, if they have the antibodies to the virus. It's a good idea to test yourself. Test yourself now, test for the virus, and test for antibodies to the virus, and test for that liver enzyme that I mentioned a moment ago, the ALT, the alanine aminotransferase, and do the test again in 4 to 6 months. What's the likelihood that if you're splashed in the face, that maybe some of the virus will be transmitted by the eye? Very, very unusual. We have a rule of threes, actually, in medicine. It said that if you're stuck accidentally with a needle contaminated with the hepatitis B virus, the likelihood of transmission on just one stick could be as high as 30%. Probably, as I said, somewhere around 1 to 3% if you're stuck with a needle with the HCV, hepatitis C. If you're stuck with an AIDS-contaminated needle, the likelihood of infection is only about 0.3%. Now, all of that obviously depends on a variety of factors, including how deep the needle is, how contaminated it is. But that's a pretty standard rule. We also know that it's possible to, at least in the animal population, the experimental animals, chimpanzees, who were infected, we can find the virus in saliva, but we have no evidence that the virus is passed through saliva among people. Now, what about pregnancy? What's the likelihood of passing this particular virus to your child during the time of childbirth? Well, the likelihood of transmission is relatively small. It's somewhere around 2 or 3 or 4 or 5%. It's the likelihood if the mother is also HIV positive, has the AIDS virus, well, it increases quite dramatically. The other risks associated with transmission of the virus have nothing to do with specifics, but they have to do with poverty. They have to do with the lack of an education, have to do with being either divorced or separated. Those social issues seem to identify a pool where there's a greater likelihood of infection and then obviously a greater likelihood of transmission. Now, who should we screen? If we just screen those people who we think are at risk, we're going to miss a significant number of people who are infected. And that's why the government came up with the idea that we ought to be testing those people who were born between 1945 and 1965, especially because the overwhelming majority of people who are infected are going to have absolutely no symptom. So if you're not sick, how do we find you have the virus? But here's a major issue. The major issue is, at the present time, there is no evidence that detecting the virus in an asymptomatic stage is going to change the overall likelihood that you will suffer some morbid or some fatal event. On the other hand, if we find the virus, there is very good evidence that you are going to have significant anxiety. We're going to label you. There's going to be stigmatization that might occur. And in those people who have the recommendation that they undergo a liver biopsy, well, the liver biopsy is certainly expensive. It can lead to bleeding, it can lead to pain, and it can lead to, in a very small percentage of the people, can lead to death. So the question again is, if we have a condition for which it would appear that we don't have any great likelihood of progression, should we actually go out and find the virus? Well, another issue is, if we find the virus, and if we treat the virus, and if we cure you, what's the likelihood that you'll be reinfected? Well, you don't get any immunity, as I mentioned a moment ago. You have no immunity to this kind of condition, and as a result, we know, at least in those people who are intravenous drug abusers, who constitute the largest group of people who are newly infected, well, they're probably still going to be intravenous drug abusers, and if they are, they're probably going to become reinfected. Well, if you're infected with this virus, if you're infected with the hepatitis C virus, what happens? Well, actually, about 1 person in 4 or 5 are going to clear that virus spontaneously. Those people are not going to have any symptoms. About 50% up to maybe 80% are going to go on to develop chronic disease. But just because you have the virus inside, just because it's there, doesn't necessarily mean that you'll know you're infected. Well, what's the likelihood that you're going to clear the virus? Well, if you're a woman, chances are greater than if you're a man. If you have a higher level of that blood chemical that I call the ALT, the alanine aminotransferase, the test of liver function, the higher it goes, the more likely you are to be cleared. And it would appear that certain people have genetic ability to clear the virus. They just inherit the ability to clear the virus. Now, if we look at those people who were infected with the AIDS virus, well, that might be as many as a third of the people, especially in some studies in Europe. Well, those people seem to go on and they progress more rapidly, causes acceleration. So if we look at the people who are infected with HIV and the hepatitis C virus, the likelihood of those people progressing to cirrhosis of the liver is probably 25% in a relatively short period of time, as opposed to maybe 5 or 6% of the people who are not co-infected with both of those. If you're co-infected, you have a higher likelihood of progressing to acute hepatitis or fulminant hepatitis. Obviously, a very significant issue. Well, if you're infected with the virus, what kind of symptoms are you likely to have? Well, the good news is that if you're infected with hepatitis C, the likelihood is that you will have absolutely no symptoms. As a matter of fact, only about 1 person in 4 is going to develop any kind of symptom. People are not going to develop jaundice. People are not going to have any significant symptom. You will not know that you're infected. And as a matter of fact, from the time you're infected until the time symptoms may appear, if they're going to appear, is probably going to be about 2 months. Can range anywhere between about half a month and 5 or 6 months. But overall, it's going to take about several months after infection for you to become symptomatic in those rare cases when symptoms are going to develop. Now, we also know that the virus will be cleared in probably only about 1 person in 4. We know that spontaneous relapses of the virus may occur. You may, once you're infected, have symptoms in a small percentage of cases. And in those particular cases, the disease seems to just disappear. It disappears after a relatively short period of time. If the virus is present and we go on past several months, there still is a tiny, tiny percent that's going to clear spontaneously. However, the overwhelming majority of people will not clear. They will have fluctuating levels of the ALT. It'll rise a little bit, it'll go back down a little bit. The amount of virus in the system goes up a little bit, goes down a little bit. We call it chronic viral hepatitis if you're infected for a period of more than about 6 months. If you're infected and we can find that you're infected during the acute stage, what's the likelihood of success with therapy? Well, if you're totally asymptomatic, but we find the virus inside your system because we test for you just by happenstance, then the therapies, the new therapies, seem to work very well. The old-fashioned therapies that were old-fashioned just a couple of years ago, they were standard in vogue up until several years ago, the interferon and the ribavirin, well, they didn't seem to work too well. Well, let's say you're infected and you develop symptoms. What kind of symptoms are you likely to develop? What are your manifestations? Well, one, hepatitis can lead to jaundice, where your skin turns yellow. You can suffer typically from anorexia, you lose your appetite, you have nausea, you just don't feel well. You have the symptoms that you would expect from a common cold or the flu. You have muscle aches, you're tired all the time, maybe you have some belly pain. You can have flu-like symptoms. If we look at those people who are likely to have symptoms, we find that people of Asian descent or the Pacific Islanders are less likely to have symptoms, while American Indians and natives from Alaska more likely to have symptoms. People who are of color, unfortunately, more likely to have symptoms and go on to some sort of complication. Now, we know that there is considerable variation in the virus. It's not just one hepatitis C virus. There are hundreds of kinds of virus, hundreds of different subspecies and types of the virus. But we know that there's a genetic polymorphism in the virus and in the person. And if you happen to get lucky on both counts, then you might be able to clear the virus. Does it progress? Well, yes, indeed, it may progress. It progresses slowly over a period of time. And when we come back, we're going to talk about some of those issues. Anyway, thanks for watching. Stay tuned.